Nearly 1 in 3 adults worldwide has excess fat in their liver, and that silent buildup raises your risk of diabetes, heart disease, and advanced liver damage much faster than most people expect, according to global liver health reviews and patient guides from the Mayo Clinic and Harvard Health. If you are eating the wrong foods right now, you could be actively worsening your liver every day, even without symptoms. Evidence-based support from liver specialist societies shows. This video will expose 7 common diet mistakes that make fatty liver worse, show the precise changes that help reduce liver fat, and give you a 3-step action plan you can use starting today, backed by clinical guidance from major liver centers. Before we begin, here is a quick medical disclaimer to be clear. This video is for educational purposes only. It does not replace professional medical advice, and you should consult your healthcare provider before making major changes to medications, diet, or exercise as recommended by clinical practice guidelines. Welcome back to Mindful Health Fitness. Today, we're deep diving into 7 fatty liver diet mistakes making it worse. Tip number 1, relying on sugary beverages and hidden added sugars is a major driver of liver fat. Research shows that high intake of added sugar and fructose from sodas, fruit drinks, and many packaged foods directly increases liver fat accumulation. What this actually means for your daily routine is swap out sugar-sweetened drinks for water, sparkling water, or plain tea. Aim for 0 regular sodas and limit fruit juice to rare occasions. And if you need a target, keep added sugar under 25 grams per day for women and under 36 grams per day for men as general guidance used in nutritional counseling. But this next common pantry item is silently sabotaging weight loss and liver health, and most viewers miss it. Tip number 2, overeating refined carbohydrates and white flour products, such as white bread, many pastries, and white rice, promotes insulin resistance and promotes more liver fat deposition after meals, according to nutrition reviews and clinical recommendations. Practical change: replace refined grains with whole grains like brown rice, oats, quinoa, and whole wheat bread, and aim for 2 to 3 servings of whole grains per day. For example, 90 grams cooked oats or 150 grams cooked brown rice, which is about 3.2 ounces or 1 cup cooked, to stabilize blood sugar and reduce postprandial lipogenesis. But an even subtler timing habit around meals can double the benefit for liver enzymes, and you'll want to hear that next. Tip number 3, eating too much saturated and trans fat from processed and fried foods increases liver fat and inflammation, while replacing these with monounsaturated and polyunsaturated fats is associated with improved liver fat in trials and population studies. For a practical target, choose olive oil, nuts, seeds, and fatty fish twice a week, and limit red and processed meats to occasional servings, aiming for no more than 70 grams or 2.5 ounces per serving when you do eat them, as recommended in dietary guidance for liver health. But the surprising fat you should not overconsume is found in many healthy bakery items, and most people don't realize it. Tip number 5, assuming that all fruits are harmless in unlimited amounts can be a mistake for some people with advanced insulin resistance, because very high intake of fruit juices and dried fruit concentrates, fructose, and calories, which can feed liver fat, experts warn. Keep whole fruit portions reasonable. Aim for 2 to 3 servings of whole fruit daily. For example, 1 medium apple or 150 grams or 5.3 ounces, and avoid fruit juice and limit dried fruit to small portions like 30 grams or 1 ounce as an occasional snack. But the next dietary habit many call healthy actually spikes liver fat in as little as a few weeks, and you'll be surprised what it is. Tip number 5, neglecting portion control and overall calorie balance, even when you think you're eating clean, is one of the strongest predictors of persistent liver fat. Modest weight loss of 5 to 10% body weight reduces liver fat and improves markers, according to clinical practice guidance and randomized studies. A practical guideline used by liver clinics is a steady, sustainable calorie deficit to lose about 0.5 to 1.0 kilograms or 1.1 to 2.2 pounds per week until you reach a 5 to 10% weight loss goal, combined with Mediterranean-style eating. But the small daily habit after dinner that doubles your chance of reaching that goal is often overlooked, and next we'll cover it. Tip number 6, continuing to drink alcohol or thinking moderate drinking is safe for every person with fatty liver can accelerate liver damage. Many liver societies recommend limiting or avoiding alcohol because even moderate amounts can worsen liver fat and inflammation in susceptible individuals. If your fatty liver is from alcohol, stop drinking entirely. And if it's non-alcoholic fatty liver, discuss safe limits or abstinence with your healthcare provider, and consider avoiding alcohol while you work on weight loss and metabolic health. But there is one commonly used over-the-counter substance that also stresses the liver, and you need to be careful about it, coming up next. Tip number 7, ignoring medications, supplements, and herbal products that can worsen liver function, for example, excessive doses of some over-the-counter pain relievers or unregulated herbal supplements can add toxic stress to a fatty liver. Clinical guidance advises checking with your healthcare team before starting supplements. Practical steps include reviewing all prescription and over-the-counter medications with your clinician, avoiding unnecessary high-dose vitamin or herbal regimens, and only using supplements like omega-3 fish oil after medical discussion, since omega-3 has shown benefit for triglycerides and sometimes liver fat when appropriately dosed. But the daily lifestyle layering strategy that ties all 7 tips together is the single most impactful change for liver health, and I'll share it in the action plan next. Like and subscribe for more science-based liver and metabolic health videos, and while you're here, click the bell to get notified because we post weekly evidence-based guides. Action Step 1. Adopt a Mediterranean-style eating pattern that emphasizes vegetables, whole grains, legumes, nuts, olive oil, and fatty fish. Aim for 150 minutes of moderate exercise weekly and strength training twice a week. This combined approach is recommended by major liver centers for reducing liver fat and improving metabolic health. Action Step 2. Set a realistic weight loss goal of 5 to 10% body weight if overweight. Use a gradual calorie deficit of about 500 calories per day as a starting point to lose roughly 0.5 to 1.0 kilograms or 1.1 to 2.2 pounds per week until you reach a 5 to 10% weight loss goal, and monitor progress with your healthcare team. Action Step 3. Eliminate sugar-sweetened beverages, limit alcohol as advised by your clinician, reduce processed and fried foods, and check supplements and medications with your provider to reduce added liver stress, a combined harm reduction approach endorsed in clinical reviews. Community question: which of these 7 diet mistakes surprised you the most, and what small change will you try this week? Leave your answer in the comments so our community can learn, and I'll highlight smart replies in the next video. Brief closing: remember, science-backed management of fatty liver focuses on sustainable diet changes, physical activity, and clinical follow-up, and the small daily choices you make now add up to major health gains over months. Thank you for watching Mindful Health Fitness. Make the change, check with your healthcare team, and I'll see you in the next evidence-based guide.